Perfect. We're going to get started here tonight, guys. First of all, good evening, everyone. Welcome to tonight's AMT x HOSA webinar. We're so excited to have you join us tonight as we learn a little bit more about AMT's mission and their partnership with HOSA. We hope you've had a great day today. And on behalf of the IEC, welcome. Now, my name is G. Sridhar, and I have the honor of serving as an officer on this year's International Executive Council. My journey with HOSA began several years ago when I joined as a sophomore in high school. And it first started with competitive events, actually. Having the opportunity of going to ILC and competing for my chapter was a phenomenal experience. Throughout my HOSA journey, I've served as a state officer for South Carolina for 2 years and recently was elected for the IEC this past summer. Once again, competitive events was truly a big portion of the starting point for my HOSA journey. And that really kicked off, ensuring that I went deeper and deeper. And I've seen that HOSA empowers us exactly to turn that curiosity into purpose the same way that it did for me. And it's inspiring to see so many of you here tonight eager to learn and grow as future health professionals. And that credit goes to organizations like AMT. It's because of our partnerships with organizations like AMT that we can ensure that our HOSA members have a platform and an opportunity to learn, grow, and lead as future health professionals, the same way that it did help me with competitive events. We hope that these webinars, these sessions, and our partnerships help you grow as leaders within HOSA. Before we begin, I want to take a moment to thank our incredible partners at the American Medical Technologists, AMT, for hosting tonight's webinar and for their continued support of HOSA's competitive events through a phlebotomy competition. AMT's partnership helps bring hands-on healthcare education to life, allowing our members to apply their skills in meaningful and career-building ways. We're especially excited to welcome two special guests tonight from AMT who are truly phlebotomy experts. Mr. Jeff Lavender, a member who served on the AMT Board of Directors as a past president, a retired Army Surgeon Major, and phlebotomy instructor at Pikes Peak State College. He brings nearly 3 decades of experience in military medicine and laboratory science. We're also joined with Ms. Francine Oren, a registered medical assistant and phlebotomy technician who has spent over 20 years teaching and mentoring future healthcare professionals in laboratory procedures and patient care. We're deeply grateful to both our attendees and to AMT as a whole for their commitment to educating and uplifting our members through their expertise and support of our competitive events. Additionally, this meeting is being recorded. So for anyone who wasn't able to join us live tonight, this meeting will be posted on YouTube as well as the HOSA website for other members to watch. Additionally, if you have any questions throughout the meeting, please feel free to use the chat and we'll try to answer as quickly as possible. Again, on behalf of the IEC and HOSA-Future health professionals, we want to extend our deepest appreciation and gratitude for AMT. With that in mind, it's my pleasure to turn it over to Ms. Susan Rajakovic, AMT's Director of Marketing and Partnership, to officially kick off tonight's webinar. Thank you, guys.
Thank you, Jeet, for that warm HOSA welcome. Good evening, everyone, and welcome to the webinar, the HOSA Phlebotomy Competition, sponsored by AMT. On behalf of AMT, I'd like to thank HOSA for this wonderful opportunity. I'd like to thank Bergen Morehouse and Bobby Crandall and Jan Mold, who will be with us tonight on the webinar. With us tonight from AMT, I have myself, I'm the Director of Marketing and Partnerships. We have Kathy Celia with us tonight. She's our Executive Director, and Nancy Podelic, our Senior Partnerships Senior Account Executive, both of whom are going to be behind the scenes answering questions in the chat. So if you have questions, please feel free to put them in as we go along. We also have our phlebotomy subject matter experts, Jeff and Fran, with us, and they were introduced earlier by Jeet. Thanks so much, Jeet, for that warm welcome. So thanks again for joining us. Tonight we're going to talk about why phlebotomy. We're going to talk about the HOSA phlebotomy competition itself, the materials, resources, and information that will help students be successful. We're going to talk about how the competition connects to careers. And then lastly, we're going to talk a little bit about certification, what it is and how you could potentially earn certification. We'll also have some time at the end for questions and answers. And I'll also put up a contact information slide for AMT. So if you think of a question later after tonight, you can reach out to us if you have further questions. So Fran's going to start us off.
Okay, let's start with what the practice of phlebotomy entails and why it matters in delivering healthcare. Here's why you might find phlebotomy of interest as you consider how to get entry into the healthcare field. It can be a great starting point for a career in healthcare and the medical field. Phlebotomists work directly with patients within a variety of settings. Training typically will take less than a year for certification as a registered phlebotomy technician, RPT, through AMT, and we will speak to this later in the presentation. It does provide a good salary. National average annual wage is $45,371 as of August of 2025. You can also work as a phlebotomist as you continue your education into other healthcare roles. If you choose to learn phlebotomy, you can be part of a critical service in healthcare. Physicians rely on the information from blood samples to diagnose and treat patients. And due to the aging population, it requires more medical attention, leading to a continued demand for phlebotomists. The rise in chronic diseases such as diabetes and heart disease require ongoing medical monitoring, including diagnostic testing done by the phlebotomists. Advancements in healthcare increase the need for clinical laboratory testing. Using blood samples in research, testing, and development of new treatments and medications. Also, the expansion of telemedicine, which means the need for remote diagnostic testing, including the blood testing. So phlebotomy is important, but what does the day-to-day work look like? These are the essential tasks of the phlebotomy technician. Verify a patient or donor's identity, explain their work to help relax the patient or donor so they don't feel as nervous about having their blood drawn, draw blood from patients or blood donors, labeling the collected blood for testing or processing, labeling sterile containers for other samples such as urine, and also instruct patients on proper collection procedures. Enter sample information into a database, assemble, maintain, and dispose of medical instruments such as needles, test tubes, and blood vials. Also keep work areas and equipment clean and sanitary. So we shared the positives of being a phlebotomist, and like any important work, it has its challenges too. There are some misconceptions about phlebotomy. Some may think that phlebotomy is basic or an easy skill that most people can perform, but the reality is that phlebotomy requires accuracy and skill. It might look easy to stick a needle in a vein. While anyone can stick a needle into the vein, the reality is that only a properly trained phlebotomist can recognize and prevent the multitude of things that can cause injury, inaccurate samples, and the mismanagement of patients and samples.
Thank you, Fran. So AMT, we're a certification agency and a membership organization where we have phlebotomy technicians, medical laboratory scientists, medical laboratory specialists, medical assistants, dental assistants, many allied health roles. We come together and network, and it's a great organization. I hope most of you will consider joining us someday. And we're very proud to sponsor, and this is one of our biggest things that we get to do, and I think it's a great partnership here that we have with HOSA. I've attended the last 3 international, and it's been awesome. But let's get on to it. Let's get on to the challenge of a competition. Let's talk about the actual competition that hopefully all of you will be doing here at HOSA. So it's open to all secondary and post-secondary students, but middle school is not ready yet. So you have to be 18 to do your clinical, so get ready to start doing it in high school. So as an introduction to the medical discipline of a phlebotomy technician, in this HOSA competition, you will take a written test first to be able to show competency, and then you'll perform 2 to 3 hands-on skills out of the 8 possible skills. And you'll find those skills on the HOSA website and on the AMT website, which we'll show you in a minute. And you can see some of the tasks there that you'll have to perform and some ways that you'll get ready, interact with simulated patients, identify veins, stick needles in venipuncture training arms, draw simulated blood, and we have some study materials that we'll give you as well. So you'll have a competition at various levels, regional level, which will move on to the international level, which will be held in Indianapolis in June of next year. I hope to see you there. Okay, let's talk about the round. There are 2 rounds. So the first one is you'll take a written test of which you have to pass before you can move on to the second round. And then, so the written test, you see the subjects there. Obtain blood samples, of course, specimen collection and processing, and some safety and general skills as well that all phlebotomists have to have. And all these topics are the exact same topics that you will find on the AMT National Certification Exam. So if you can master these topics and do well, you'll have no problems passing our exam as well. So the written test has 50 multiple choice questions. The test topic that includes the most questions is obtaining blood samples at 42%, and that should make sense to you. And the topic with the second most questions is specimen collection and processing at 16%. So like I tell my students, when you study, spend most of your time studying on those topics and maybe a little less on the other topics. So here's a couple of sample questions on the next slide here. So the first sample question, which of the following veins would be last choice for a venipuncture, being close to the median nerve and the brachial artery? So you got A, B, C, and D there. If you want to post in the chat real quick what your answer you think it is. So the first question, whether you think it's the median cubital, median basilic, median vein, or the median cephalic vein. Go ahead and take your guess and put that in the chat. The second question, which of the following white blood cells release histamine and heparin and are normally the least numerous? You got lymphocytes, eosinophils, basophils, or neutrophils. You need to know the makeup of blood. If you're dealing with blood as a phlebotomist, it's important that you understand how the makeup of blood is, what's in it, how it functions, and all that kind of stuff. So go ahead and take your best guess. And in just a second, I will give you the answers to that. So when you take an exam, it's best to read the question we call the STEM, and you read that question and try to formulate an answer in your mind. Then make sure you always read all 4 choices. You can eliminate some of the choices you know are wrong, narrow it down hopefully to 2 or 3, and then pick the best choice that's remaining. That's the best way to take a written test. Take your time with it. Read the entire question. Too many people read the question. The first choice looks good. They put A and they move on. All right, so here's the answers. The most dangerous but acceptable vein when you're drawing is the basilic vein. So the first question, the answer is B, basilic vein. And that's in the pinky side of your hand. If you look at your hand and your pinky side and you run it all the way up to the antecubical fossa by your elbow, that's where you'll find the basilic vein, and that's the most dangerous of the 3. The second answer is C, basophils. Basophils contain histamine and heparin, and they're important in anaphylactic stuff. All right, I hope you did well. You got B and C. If you got that, you're on your way already. All right, let's talk about the hands-on assessment. So you get past the written test, you come to round 2. So this is a series of tests that are timed. You have to successfully demonstrate that you can complete the skill accurately within the allotted time. These times vary anywhere from 2 minutes to accurately and safely apply a tourniquet to 10 minutes to do a routine ETS venipuncture that shows that you also understand the order of draw. By the time you get to the competition, you will know what ETS stands for and what we mean by order of draw. So here's what will happen is you'll show up to the site. This has happened at the regional state. I also judge the Colorado state, and it runs just as well, the same way as the international competition. So you'll show up at the room where the competition is, and then you will be escorted. When it's your turn, you'll be escorted to the judging area. The judge will show you around and show you what equipment and supplies are available. And then you'll be given a scenario to read. And that'll tell you everything you need to do, or at least will imply what you need to do. So you have to read the scenario and figure out what task you're doing. Once you read the scenario, your timing starts. While you must perform, not just talk your way through, but perform every step, I also recommend that you talk your way through so the judge knows exactly what you're trying to do and doesn't miss anything. So as you see here in the photo, you may have a real patient, a mock patient, and then you may have simulation stuff just as well. So you may go back and forth between the two. So here the phlebotomist was working with the patient up until they were ready to stick the needle in, and then they went to a simulator and did that. All right, let's move on. Routine venipuncture. So phlebotomy is a medical practice that requires accuracy, precision, and order. Routine venipuncture requires 41 steps for a proper blood draw. So you got to memorize all 41 steps. And the sample collection tubes are colored to distinguish their use for different laboratory tests. So it's best to memorize the steps in order, but remember you have to perform them. So practice is key. You need to perform those tests over and over, practice it over and over and over again. All right, so let's look at a skill sheet. So here's the venipuncture skill sheet. This is what the judge will use. Okay, they're all found on the HOSA event guidelines on the HOSA website, and there is a link on the AMT website HOSA page as well, and Susan will show you those later on. So the total possible judging points for a routine ETS venipuncture is 69 and is assessed based on the 41 steps in the venipuncture skill. Each step is listed on the skill sheet that I displayed here. So have you figured out what ETS stands for? It stands for evacuated tube system, because the tubes that you draw have a vacuum in it and they literally suck the blood out of your vein. So maybe you can use that for Halloween. I don't know. You figure it out. All right. Here's another example. This is a venipuncture using a butterfly and evacuated tube adapter. So not all venipunctures are done by routine. So this one has 70 points with 40 steps. Yes, you got to know all 8 of these skills because you won't know which skill you'll get until you show up. So you're going to have to memorize all 8 and practice all 8. Here's one on removing contaminated gloves. It's very important you don't contaminate yourself once you remove the gloves. Most of these skills, especially these shorter ones like this one, will be combined with 1 or 2 other skill sheets. So this one has only 16 points, 8 steps required. It's probably going to be combined with one of the other skills. All right, sometimes you have to brief a patient on something rather than actually do something. In this case, is how to collect a 24-hour urine sample. So you'll know the steps and you'll have to actually brief a patient on how to do this. A high level of detail and precision is necessary for urine specimen collection too. The sample will be used for detection and diagnosis. It's very important for the laboratory and for getting accurate results when the tests are run in the laboratory or the clinic. All right, let's not forget about those little babies. Newborns are patients too, so you may have to do a heel puncture on them. So this is a form of capillary puncture, and you do a heel puncture similar to a finger puncture, but it's a different location on the body. So it's important you go through this, and you may be given a simulated heel, and you have to draw blood from it. We actually did that one at the international competition this year. So you never know. All right, I got one final example for you, and this is fainting. So how do you react when a patient has a problem? So a well-prepared phlebotomist is confident when dealing with fainting or any other problems we'd have. So we don't present these to scare you, but by studying and preparing, you know how to appropriately respond with competence, not fear, when you're faced with these common situations. Like fainting patients, collecting a specimen from an infant, all these are important for the test. Okay, so that's basically your competition. So Fran, why don't you tell us some useful information and materials?
Yeah, we hope that you are excited to hear about the challenges and rewards of phlebotomy. So how do you find out how to prepare to succeed at this phlebotomy competition? Here is the helpful information and the training materials to get you there. I recommend that you start at the AMT HOSA webpage. Susan will tell you a little bit more about AMT in a minute, but AMT is the sponsoring organization for the National Phlebotomy Competition, and AMT has published some specific details that you'll need to know about the competition tests, as Jeff had just explained to you, including all the skills that you will be assessed on. This page is where you will find all the detailed information about textbooks, hands-on resources, and links to the HOSA competition and rules. Specifically, there are 2 recommended textbooks by phlebotomy experts from independent publishers. You can find links to purchase these texts from the page on the AMT website or in the HOSA guidelines for the phlebotomy competition event. Students could also inquire if their school library may have them or could order them online. You will also find links to readily available practice materials from a mix of accessible online shopping tests or sites, These are a variety of practice materials, so you can browse and see what you may need for your own purposes. I actually, at my school, have the Venatech that's in the first picture, and we also have the phlebotomy arm that's in the second picture. The phlebotomy arms usually run more, but they both are really great resources. You can use this QR code to get to the AMT HOSA page where all the detailed information we just spoke about, such as textbooks, hands-on resources, and links to the HOSA competition and rules reside.
So we hope you're excited hearing about the rewards of phlebotomy. The next thing we're going to talk about is connecting to careers. So how competition connects to your career. Here's how the phlebotomy competition can help you build your portfolio. First of all, it's a professional role. One powerful aspect of the HOSA phlebotomy competition is the potential path for students to become phlebotomy technicians and work in a professional allied health role. Phlebotomy skills are in high demand and across a variety of allied health professions. So with all the knowledge that you're going to gain in this competition, just take it a little bit further to see how to become an actual phlebotomy technician. AMT can help you learn how. Earn while you learn. Becoming a phlebotomy technician could help you earn competitive wages while you continue your studies or work toward another healthcare role. Experience and networking. By working in the field, you can develop relationships with employers in your field of interest and make career contacts for the future. You can also use phlebotomy as a stepping stone to another career in healthcare. So there's many opportunities in both labs and medical areas. And a crucial step to remember is it's important to become certified. Many employers either require it or prefer it for entry-level positions. It can give you a competitive edge over others. AMT is a certification agency, and one of the certifications we offer is the Registered Phlebotomy Technician, otherwise known as the RPT. So in 2024, the first place winner in the secondary division, Stephen, did just that. He was able to sit for his certification exam and was successful, making him an automatic member of AMT for life, provided he keeps up his certification requirements. His plan is to work as a phlebotomist to help fund his desire to attend med school and become a surgeon. So you can read about his story, Stephen's story, on how he became certified through AMT. You can find this on our AMT website HOSA page, or by clicking on the QR code that'll also take you to the AMT HOSA page. AMT through HOSA will also be hosting another webinar. The date is still TBD, but it'll be in winter or early spring, where we will talk more about why certify, the importance of certification. And Stephen is going to be a guest star there. So please join in and hear about his journey in obtaining RPT certification and why it was really significant for him and of value to him. So you might ask, what exactly is certification, and why should I want to become certified? Well, certification is a third-party validation that the individual seeking certification has demonstrated the proper knowledge and the hands-on skills required to perform that job. So once a person is certified, they're able to use that credential, such as RPT, after their name to show they earned that credential. Just like you see credentials after a doctor's name or a nurse's name, RPT is the same. After you complete the HOSA competition, you may be interested to find out that you're already well on your way to prepare to get a professional certification, such as the RPT. You can prove your competency in phlebotomy through AMT's RPT professional certification, which employers recognize for its quality, and it's also recognized nationally. So carrying an AMT credential not only enhances your employability, but also demonstrates your commitment to excellence in patient care. Now, I do want to be clear here that getting certified is not part of the phlebotomy competition. I want to repeat that. Getting certified is not part of the phlebotomy competition, but it is something we do encourage all of you to do afterwards to get certified, as the benefits are many for you. So be sure to check out more about phlebotomy as a profession, as well as the eligibility requirements for RPT certification on our AMT website HOSA page. The QR code will take you there. So if you do choose to go down the path of getting certified, AMT has ample resources to help you succeed on the certification exam. We have a course called Fundamentals for Phlebotomy Technicians. This is one resource. It's a review course and has online modules created for learners who need to brush up on the basics or prepare to pass the certification exam. So this is one resource. And then we also have practice exams and free exam content outlines that are also recommended for preparation. So once you pass the certification, the AMT certification exam, you automatically become a member of the AMT professional organization. So Jeff and Fran are both members of AMT, as is Stephen, who I explained to you a little bit earlier. So you might ask, who is AMT? So like HOSA, AMT began because industry professionals saw a need to improve the field. For HOSA, it was educators in the health occupations field, and for AMT, laboratory professionals and leaders joined together over 85 years ago to improve the allied health professions. So we are a not-for-profit certification agency and professional membership association with over 100,000 members. AMT is valued and trusted by employers for our integrity, our diversity, and practicality. We have 12 different certifications that include the medical, dental, and laboratory fields, as well as a certification for allied health instructors. So if there are any advisors on the call, advisors might be interested in the allied health instructor certification. So one of AMT's strengths and differentiators is our diversity. And because we offer medical, dental, and laboratory certifications, as well as health education for instructors, this diverse membership among the varied allied health certifications delivers greater versatility and a broader, well-rounded perspective about the skills, knowledge, and competencies that members can leverage in their careers. It affords members the ability to learn from their counterparts in other allied health roles, just like you would in a professional setting. So here in summary is a slide that takes you to all the resources that you would need. On the left side are all the competition resources for the phlebotomy competition. This is where you can find the textbooks, hands-on information, the resources, links to the HOSA competition, and where the rules reside. You can also find everything on our HOSA AMT HOSA page, americanmedtech.org/HOSA, or by clicking on the QR code. And on the right side of this slide, I have listed certification resources. So here this will help you for those that are interested in understanding how they might get certified. You can click on the QR code, which will take you to our AMT HOSA page. And there you can look under certification and find out more information on certification. AMT is always happy to answer any further questions you might have on that. So now we have time for questions and answers. If you want to put your questions in the chat, or Bobby's gonna help us field some questions from the chat too that we'll answer for you.
Susan, before we do questions, I want to clarify something that I said. I said about being 18 years old. If you go through a formal AMT, I'm sorry, a formal phlebotomy school, pretty much most states will require you to be 18 to do the clinical. However, for HOSA, any high school or HOSA member in high school or secondary school can compete in the HOSA competition. You don't have to be 18 to compete. You do have to be 18 to take our certification exam, however, because you do have to complete 50 successful venipunctures and 10 dermal punctures in a clinical setting.
We do have, I do want to add that we do have provisional certification though for those who, so if somebody is 16 and they're going through a program and they're not 18 yet, but their the state requirements vary from state to state. Some states will let you do blood draws when you're younger, but some require you to be 18. So we do have provisional certification. So if you have to wait until you're 18 to do those blood draws, we do enable you to take the exam, and you'll be provisionally certified until you can actually get those venipunctures and capillary sticks done.
Just a couple quick questions in the chat. This is recorded. We will email it to everybody, not just those registered, but the whole HOSA network. It's going to be on the HOSA YouTube page in about 48 hours. It'll also be on the HOSA website, so you can watch this and share this if you'd like. There have been several questions about when individual competitions are. We would recommend that you contact your state. I'm sending a link in the chat that has the state conference dates and the primary contact. Your state might have a regional, you might have a state leadership conference, but you should check in with your state advisor for when the competitions are. One of the first questions, Susan, is AMT certification available in all states?
Yes, AMT is a national certification, so you get it through us, but yes, you are able to, every state, you can do it for every state.
And internationally, we're big in the Caribbean and some other countries as well.
There have been a few questions about the exam. The HOSA competition exam is 50 questions. I believe the team shared that through AMT membership, there are practice exams for their test, not the HOSA competition. Susan, do you want to speak to that?
Yeah, that is correct. So we do not have practice exams available for the HOSA competition. There are no practice exams for that. AMT does have practice exams that we offer for our certification exam. So they're two different things. So if you decide you want to take a practice exam, it is not indicative of the HOSA, the HOSA competition. So I just want to make that clear.
We've received a couple questions, and Susan, you mentioned this with Stephen's story. Would you speak to how phlebotomy can be beneficial as folks go on to other professions within the health industry?
Can I
Sure,
answer that real quick?
Yeah, go ahead, Jeff, if you want.
Yeah, so most of my, I would say at least half of my students are looking to go on to other things, radiology, nursing, medical school. And they take it one as an introduction to healthcare. It's a great entry in a lot. But if you're competing to get into a competitive program such as nursing or radiology, if you've already taken a healthcare program and passed a national certification exam, and you're competing against someone who just came out of high school and has done nothing in healthcare outside of high school, who's going to get in first? The one that's taken a college level national program and passed a national certification exam, they're a better risk. Also, if you're on the bubble or you're pretty sure you want to go into healthcare and not 100% sure, phlebotomy is 1 semester, whereas pre-nursing or pre-med is 2, 3, 4 years. So I would recommend to do phlebotomy that way. It's a great introduction because you're going to learn anatomy and physiology. You're going to learn safety. You're going to learn about various healthcare regulatory agencies and first aid, medical terminology, professionalism, how to deal with patients and body fluids and things. So you're going to get a good overview of everything. Are you going to be a doctor when you graduate? No, but it'll give you a great introduction of what to expect to come out, which of course you expand greatly on it. So I write a lot of letters of recommendation for my students when they graduate. And as far as I know, they have all gotten into the schools they wanted to get into after passing my course and the AMT exam.
Jeff, I know you touched on this with the sample questions, but we've had a couple different questions about the HOSA competition exam and the makeup, if it's all multiple choice, if there's any other types of questions besides the multiple choice.
Sure. Yeah. Actually, I scrolled back and I got a whole lot of right answers. So a lot of you are already on the ball, doing very well, got the right answers. So that's great. You're off to a great start. The HOSA 50 question exam was written by Fran and I and one other, and we wrote it to look very much like the AMT exam. Of course, the questions are not word for word or exactly like you'll see on the AMT, but they are all 4 choice, multiple choice questions. There's no short answer, fill in the blank, or essays. They're all multiple choice. And the AMT exam will be the same way. 4 choices, a multiple choice. There's no matching, nothing like that. 4 choice, multiple choice.
Thank you for that.
Answer your question
Again,
about McCall's Phlebotomy Essentials, the 7th versus the 8th edition. I jumped last year from the 7th to the 8th. There's not a lot of differences. She expanded on a few things, but most of the changes were made in 2017. So the 7th, most of the changes to the national standards, the CLSI standards. So the big change was to the 7th edition. If you have an edition of McCall's Phlebotomy Essentials that's older than the 7th edition, you need to get a new edition. But the 7th and 8th, there's not a significant difference.
However, I do believe that the latest edition is what the guidelines are
That's the
referencing.
8th. Yeah, that's the most recent.
Fran, what's your favorite part about phlebotomy?
Oh, wow. That's a good question. So I learned how to do phlebotomy in 1981. You do the math. It's been a while. And I was afraid, I didn't want to hurt my patients, but it ended up being my favorite skill. I really enjoy helping people. And by doing a good phlebotomy skill procedure for your patient, it's very rewarding. I love teaching it. It's just been a huge boost for me, and from education, being an educator and also practicing, I've just really enjoyed phlebotomy. I can't narrow it down to anything specific, but just helping people.
Jeff, same question.
So I'm a medical laboratory scientist, so I actually get to do all the testing with it as well. But I think phlebotomy is the most important part because the testing is only as good as the sample that you collect. So even and the phlebotomist also is the face of the laboratory. You don't see the lab techs because they're back, back room behind a big giant biohazard symbol where you're scared to go into. But the phlebotomist is out there touching the patients. So phlebotomy is extremely important. You got to get that quality sample, and the people have the attitude of what the lab is like and their lab tester are like based on that phlebotomist.
We've gotten a couple questions about the process from the test portion and then the skills portion. You're going to want to talk to your state chapter to see how round 1 and round 2 is conducted. Sometimes states will do online testing, and sometimes they'll do on-site testing on a Scantron paper. So you'll just want to check with your state advisor or look at your state website and see if they've got a schedule or a process. Sometimes, just depending on the state and the size of the number of competitors, there might be 20 or 30 folks that are moving on to round 2. It might be everybody that's competing, but again, you want to check with your state advisor on those types of questions because it's different with every single state. So lots of other questions related to kind of results and appointments and things like that. You just want to check with your state because we can't answer some of those questions. We have kind of an interesting question. What would you recommend for somebody who's nervous around blood and needles? Were any of you nervous around blood and needles before doing the work in phlebotomy?
I hate having my blood drawn. I hate it, but I understand the necessity of it. So do I faint or anything? No, I have fainted when I donated blood, but then I ran 2 blood donor centers later, and one in Korea and one in Germany. If you didn't know it, the military collects all their own donor blood through the Armed Services Blood Program, and we run blood donor centers around the world, and we have frozen blood strategically placed around the world. And so we have to donate too, and we have emergency. I hate it. I hate it. But I have students all the time that's like, oh, needles and blood, but then they start sticking each other all the time and they get used to it. And then they do fine. And they understand the importance of doing it and doing it correctly.
Yeah, I agree with Jeff. Students might feel like they're hesitant or they're unsure. And then once they start learning the process and practicing on each other in simulators, they end up really liking it a lot. I have no squeamishness about getting my blood drawn, but I do watch what they're doing since, I also teach it, but I'll have some students once in a while get a little squeamish. There are some techniques that you can use to make it so that you don't faint if you are concerned about that. Having somebody talk to you or hold your hand is one. Concentrating on something on the ceiling or some kind of a pattern can help. Breathing, like taking a breath in, counting to 4, hold it, breathe out, count to 4. So, nice controlled breathing. There's just a few things that can help, but these are some of the things you would learn when you take your phlebotomy class.
Great. Thank you so much. I know we've got a couple other kind of random questions. We're going to go through and download and do a Q&A of some of the things that maybe we haven't answered. Susan, did you wanted to show the contact information?
Yeah, we have one last slide, and on it just has our AMT contact information. So again, we'll be following the webinar up with an email. It'll include a link to the webinar. We'll have frequently asked questions with it. We also will be emailing our 4 winners from our random drawing. So hope you're lucky tonight. So, please let us know if you have any other questions outside of today. If you think of anything afterwards, be sure to reach out to us.
And come and say hi to us when you're at the HOSA competitions. If you're in Colorado, I'll be there. And at the international, Fran and I most likely will be there. I don't know, Susan will be there probably. So come by and see us.
Great. Well, we appreciate everybody joining this evening. This has been a great webinar, lots of great information. We will get the recording uploaded, and we'll, as Susan said, we'll be sending out a follow-up email with all the resources. So thank you so much for your time this evening. And thank you to AMT for sponsoring a great event and a great webinar.
Thank you all.
Thank you.
Thank you.